Do you want to get rid of back pain? Back pain can be quite uncomfortable, but it usually goes away after a few weeks of home treatment. However, once you have back pain, it's more likely to recur. Back pain can be brought on by heavy lifting or sudden uncoordinated movements, which can strain muscles and cause discs to rupture. Arthritis, osteoporosis, and curvature of the spine can all lead to back pain as well. Treat minimal back pain with stretching, light movement, heat, and over-the-counter medications. For more serious and long-standing back pain, see your doctor and come up with a plan together. Ice your back as soon as you feel the pain. When you are first injured, ice can help tame your inflammation. Apply ice packs, frozen vegetables, or a frozen towel to your back during the first 24 to 72 hours of your injury. After that, switch to heat. Apply cold for 20 minutes at a time. Don't apply cold therapy more than 10 times in a 24-hour period. Put a cloth between your skin and the ice. Apply heat going forward. After the initial period of icing your injury, apply heat. Heat will stimulate blood flow and promote healing. Make a warm compress or buy one. Electric heating pads, hot water bottles, heated gel packs, and saunas can all help. Dry or moist heat may be applied. Try 15 to 20 minute sessions for minor injuries, and up to 2 hours at a time for more serious pain. Take over-the-counter anti-inflammatory drugs. You might try taking the recommended doses of any kind of non-prescription non-steroidal anti-inflammatory drugs (NSAIDs), such as ibuprofen or naproxen sodium. If these are ineffective at relieving pain, see your doctor for a prescription medication. If you take other medications and are concerned about interaction, see your doctor before you start taking non-prescription medications. Once your pain has subsided, try some simple stretches at home. Not all stretches work for all kinds of back pain, so only do stretches that feel like they are relaxing your muscles and relieving your pain. Try lying on your back on the floor. Slowly bring one knee up to your chest. Hold it for a count, then slowly extend your leg back to the floor. If your back hurts when you bend it forward, try stretching in the other direction. Lie on your stomach and prop yourself up on your elbows. If that feels fine, place your palms on the floor and extend your elbows slowly so that you are pushing yourself up from the floor. Keep your pelvis on the floor. If a stretch is painful, cease to do it until you have consulted with your doctor. Seek the advice of a chiropractor or your primary care physician to learn about the proper stretching techniques. Engage in light activities. While you may need to spend some time lying on the floor, rest is not generally a recommended cure for back pain. Rather, continue your ordinary routine as much as you can. Stop any activity that is too painful. Try going for walks, stretching, and otherwise moving around. When you need to rest, try lying on your back on the floor. Prop your knees up with pillows for more comfort. Visit a doctor if the pain is severe or long-lasting. If your back pain does not resolve within a few days, visit your doctor. Back injury that results from a fall or other physical trauma require X-rays and other medical attention. If the pain is severe and unaffected by rest, contact your doctor sooner. Seek immediate care if your pain is accompanied by numbness or tingling. Thanks for watching. Please subscribe for more.